One of the very first practical skills that students of medical sciences learn is how to take vital signs. Measuring vital signs is important because this allows information that shows healthcare practitioners how the body is functioning and alert to possible medical conditions, many of which are present without signs or symptoms. So for today's video, here is Nico S. Garcia, a licensed pharmacist. We're gonna get vital signs of his patient, which is named as Brian. Um, Brian, my name is Nico S. Garcia, and I am the one who will gonna get your vital signs. So for this session, I'm gonna get your heart rate, your respiration rate, your body temperature, and your blood pressure. Just to know, just let me know if how you're feeling today, Mr. Brian. Okay naman po ako, Dr. Garcia. Um, I feel good today po. Oh, is that so? So, that's very good. So, let's start. So, first up is I'm gonna get your heart rate. So, in getting your heart rate, you must first wash your hands as a medical practitioner. You must practice hand hygiene. Then after that, make sure that the individual is at rest and before you begin the getting the vital signs. Then after that, in getting the vital signs, you may use the brachial artery in the wrist of the patient and use your first and second finger and do not use the thumb finger. So in getting the patient vital signs, you must do it for 1 minute, then count for the number of beats of the heart rate. Then after that, um, you may after getting the heart rate of the patient, you will also um, do the hand hygiene after doing it. So let's start. So um, I count the pulse rate of my patient. He has 83 beats per minute, and I think that's normal. He's in the normal range of the heart rate. Then next I'm gonna get his respiration rate. So for the respiration rate, before beginning the procedure, always do hand hygiene or by washing your hands and sanitizing it before doing such procedures. Then in getting um, in getting the respiration rate of the patient, you must count the breaths or the inhale and exhale because that's the respiration. We have the formula that exhale plus inhale is equals to respiration. So for 1 minute, you will count that. Then after that, you may document the number of respiration rate of the patient so that you can assess that information which will gonna use for the patient care plan. So let's start. So um, before I start this procedure, I already count my respiration rate and I counted 17 respiration rate. So I think that's normal. So next is we're gonna get the body temperature of the patient. So the normal body temperature is at 37.5 degrees Celsius. So let's see if let's see. Um, so I have here so meron pa akong thermometer which we're gonna use for getting the body temperature. So, the yung pinaka magandang location for getting temperature is at mouth. So I'm gonna so my temperature is 35 degrees Celsius. So that's normal. 37.5 and above, yun po yung mayroong hyperthermia or increase of temperature. So ano next? So next is blood pressure. So in getting blood pressure, I'm gonna demonstrate it later after this.
One 20/90.
Normal o hindi? Normal o hindi?
Okay lang po siya.
So next is physical assessment in the skin for the skin. So in assessing physical assessment in the skin, you must consider the color of the skin, the quality, the distribution and condition of bodily hair, and the size, the location, color, and type of the any skin lesions are assessed and documented. The color of the nail, since we are not gonna deal with the nails, so for the for the skin, we're just gonna consider the color, if there are any lesions, how many millimeters, and all all possible some scaling part of the skin, you must documented it um so that it is easy for you um to manipulate drug therapy or care plan for the patient. So, yung examine po natin is skin sa bandang lower part ng pasyente. So, let's start. So may na-notice ako na may keloids yung pasyente natin. Bandang 2 mm po siya yung ano niya, yung ano niya. Then may mole siya. Then syempre may hair, grow of hair. Pansin din po ako na maraming scratches and keloids, I think. Wound scratches. So next demonstration is about physical assessment of HEENT, or the head, ears, eyes, and nose and throat of the patient. So first is the head. So in inspecting head of the patient, you must consider the size, the shape and symmetry of the face and skull, and facial movements, and also symmetry are inspected. So this is inspection will evaluate the trigeminal nerve function and facial nerve function of the patient. So for the head, I'm going to demonstrate it and gonna use double cara for now because I don't have any companion right here, and gonna invite him or her for for this video. So for the head assessment, for facial expression, if the doctors say that smile, so I my trigeminal nerve is working, and um, next is when the jaw. So my trigeminal nerve um and my facial nerve function is intact in that assessment. So next is for the eyes. For the eyes assessment, pupils in interference to their bilateral equality, reaction to light, and accommodation, the presence of any discharge, irritation, redness, and abnormal eye movement are assessed. So for this assessment, which is in the eyes, you will gonna document if I think the extraocular movements are intact, and we're gonna also demonstrate if the eye pupil is constricting within by using light and dilating it when it is not being in the light. So let's start.